Welcome everybody. So I'm Andrew. I'm a 2 seconds my mouse. There you go. So I'm Andrew. I'm a current trainee clinical scientist at the James Cook Hospital in Middlesbrough. So I work in the medical physics department. I'm a chartered engineer, member of the British Computer Society, and also a member of the Institute of Physics and Engineering and Medicine. So I graduated back in 2011. It feels like a long time ago now, but although it does sometimes feel like yesterday. So I graduated with a Bachelor of Science in Computing Networks. After that, I spent a couple of years working in IT. So I worked in a secondary school as an IT technician, and then I worked in the fire brigade as an IT infrastructure engineer there. And then in 2014, I moved into the NHS to become a clinical technologist in radiotherapy computing. So back then, I didn't really know what a clinical technologist was, but I saw IT infrastructure support, so I thought I'd apply for it. But it's basically a specialist term for somebody who looks after, like a specialist IT infrastructure engineer working after radiotherapy systems. So I then later graduated with a Master's by Research in Computer Science, focusing on medical infrastructure software, and that has been developed by healthcare professionals in the NHS. And now I work at the intersection of healthcare science, computer science, and healthcare, providing technical solutions to clinical problems and also getting to perform physiological measurements on patients, which is quite cool. So I'm going to talk a little bit about that as I go through the slides. If there are any questions, just go to the chat. Yeah, I will try and flick through them as I go along. So what is a clinical scientist? Now, this is a really good question. So I've got computer science, I've got a computer science education. I've worked in IT, did a bit of software engineering, learned about the computer science, and now I'm trained to become a clinical scientist. So what is a clinical scientist? So according to the Healthcare and Professions Council, the HCPC, a clinical scientist is a statutory registered healthcare professional who advises doctors on tests, interprets results, and performs research to understand diseases. Okay, doesn't really sound like a computer scientist, but bear with me. In reality, we find that they actually are medical physicists specializing in radiotherapy and radiation protection and medical imaging. There are physiologists in cardiac physiology, neurophysiology, sleep physiology, and etc. There's scientists in biochemistry, virology, microbiology, and biomedical scientists who progress to high roles as a clinical scientist, and rehabilitation engineers and some clinical engineers developing medical devices. So in reality, this clinical scientist is a huge array of different professions. There's like 20 different specialities, and there's tens of thousands of healthcare scientists working in the NHS behind the scenes that not many people come across. But I'm going to focus on the clinical bioinformaticians, the computer scientists. So clinical bioinformatics, what is that? So computer scientists can work as clinical bioinformaticians in health informatics or the more recognized physical sciences. So whenever somebody says bioinformatics, they immediately think of somebody working in a lab on genomics or omics or gene therapy or personalized medicine, and biologists and working in wet labs, and that's what people spring to mind. But it's not just that. There is clinical bioinformatics, which is there is a bit of a debate around this at the moment because it is poorly worded, so it might get renamed to clinical computing because that's exactly what it is. But it's an area of healthcare science responsible for developing and improving methods for acquiring, storing, organizing, and analyzing biological data that supports the delivery of patient care. So that's what clinical bioinformatics is defined as by the NHS. So I'm going to focus on physical sciences because that's the area I work in, but it involves software development, network topologies, database design. You're responsible for ensuring compliance to IT standards, best practice, and improving computer-related interfaces for clinical use. It bridges the gap between trust IT specialists, and other clinical scientists like those medical physicists, like those virologists and microbiologists. by providing computer science, IT knowledge, and software systems design skills. And then on top of all that, there's the sciencey part, which is the research. So you're able to do research in artificial intelligence, machine learning, big data, computer vision, so on, and apply all this to patient care directly, which I think is pretty cool as well. So I guess what we're saying here is that computer scientists can register as clinical scientists with the Healthcare Professions Council to become state registered computer scientists and work directly with patients and doctors to improve care, which is quite an interesting concept because you do sort of think about our profession as being behind the scenes and not having any patient contact or any state any registration or ability to be recognized as a healthcare professional. But the Healthcare Professions Council regulate clinical scientists. But where are the computer scientists? That's the question that I sometimes like to ask. So the route into healthcare professions state registration by the HCPC is quite unknown across the computer science community and within universities. So when I was at university, I never heard of clinical scientists. I never heard of medical physics. I didn't realize computer scientists can work in medical physics until I started working as a clinical technologist. At the moment, we've got the traditional engineers, so electronics engineers, mechanical engineers, all the different engineers and physicists who are applying for these roles. And this is not to say this is bad or it shouldn't be happening like this, because you know we can all learn new areas. But my argument is that computer scientists are taught the computer science at university and are better qualified to practice computer science. So things like software engineering, you know, I know not everybody went to university to study computer science. There is a bit of a debate whether computer science is useful or not, but the things that we're taught are things like algorithms and data structures and the fundamentals of computing. But there does appear to be some work to professionalize informatics and computing in healthcare. Some may have heard of FEDIP, the Federation of Informatics Professionals, that was set up with the BCS and some other professional bodies. And this is really interesting, but I always, from my point of view, there is a route that is already established that gets you onto the Healthcare Professions Council register, which grants more respect, trust, and authority. But I think there's a lot of misconceptions around it. I think people don't realize that they can do that. So the HCPC regulate physiotherapists, occupational therapists, paramedics, radiographers, psychologists, medical physicists as clinical scientists. So there is that misconception that, oh, I'm none of those people really, so I can't become this, but you can as a clinical bioinformatician. So I did have a look at the FEDIP website, and I've highlighted a few things in red there, which I think are really interesting about it being the only public register available for all informatics professionals that are dedicated. So yes, that's true because they're the only one dedicated, but they're not accredited by this body called the Professional Standards Authority. So the PSA are the regulators of the regulators. So they basically regulate the HCPC, which is what all the allied health professionals are registered under. Social Work England for social workers, the General Medical Council for doctors, and some non-statutory registers like the Register for Clinical Technologists, Clinical Physiologists, and the Academy of Healthcare Science registers. So the FEDIP isn't quite there yet with this PSA. So maybe one day they will attain that accredited register status, which will be interesting. But I think there's a lot of work that could be done with working with this bioinformatics training program and the HCPC with the BCS. So how do you become one? So just from my experience, so I'm training through a method called Route 2, which is an in-service route that you do by making a portfolio. So I'm doing this in physiological measurement, clinical engineering, and computing. So there is a specialism already there for computing. So this means I'm able to be involved in the work and create the portfolio who will assess me for registration. But there is a newer route that a lot of graduates take, and this is called the Scientist Training Programme. So this pays trainees at Band 6 in the NHS, which is, I think it's at the moment, £33,000 to £39,000 a year, but there'll be an annex on there, so it's only a percentage of that band. So that's a bit of a downside, but it's still quite a good salary. The trainees then earn a master's degree alongside work-based training, so they don't get as involved in the work. They're more supernumeracy, so they can float in and out of different areas, but they are able to follow a structured training program with exams and training, and at the end of it, once they've passed all of the masters and the exam, they're able to get a place on the HCPC register as a clinical scientist. So that's quite another cool route to go through. But again, so the point of this is it's open to people from computing and IT backgrounds who really want to work directly with patient care. And then what is interesting after that is that you can apply for the highest specialist scientific training program to become a consulting clinical scientist. So this is a 5-year workplace doctoral training program, fully funded, and it's supposed to be equivalent to medical consultant. So once you've finished, you get a DCLIN and a place on the highest specialist scientist register. And you can apply for these consultant clinical scientist posts. Now, this might seem like, whoa, it's really different world, but there is a specialism for clinical and scientific computing. So this is clinical computing. So computer scientists are able to pursue this and become registered as this and move up their career ladder. So there's a full structure in place in the NHS at the moment, allowing people to go from scientist to consultant and then have a lifelong career in the NHS practicing computer science and apply their computer science knowledge for patient care. So bit of a blurb about that. So why should do we really need to do this? It does seem quite a faff on for your career to pursue this. There's lots of hoops to jump through. You've got to do this masters, you've got to do then further training and exams, then you've got to get onto a register just to do this job. But do we really need to do this? Well, you don't have to become one, but you are afforded more responsibility, trust and respect to be involved in patient care. So this is true when it comes, so this is where it is really interesting for computer scientists when developing medical devices inside the NHS. So medical software, any medical devices that are used on patients, you can develop the device, the software, and use them, and also produce the results and advise the doctors on the results. So there's not many professions out there that will let you do that. Yes, you could. There is software engineering jobs in medical device companies where you can make them, but you'll never really get to actually use the device as well and understand the results and advise on the results. So it's a really multidisciplinary role. But I think more importantly, there's a lot of areas of clinical computing that are becoming regulated. And we see physicists applying physics to medicine, engineers applying engineering to medicine. So why not computer scientists applying computing? So just as the areas in healthcare become more regulated. So I've had this question asked to me before about, again, what about people who do that, who work in these industries or who work in academia, who build medical devices, but do they need to become registered? So the answer is no, not really, not everybody. It's only really the ones who are directly involved in patient care. So those are the ones who build the medical devices in-house and use them on patients and then interpret the results. That's where I think the registration is really useful, because it gives the clinical team reassurance that that with that process of going through the training and getting registered, you're almost like they are really in providing advice. You're certified to provide advice. And some more areas are now asking for clinical scientist registration. This is really true of medical physics. You'll find clinical computing jobs asking, like, and software engineering jobs in specialist departments like medical physics, now asking you to become a registered clinical scientist or have done the STP or go through Route 2. So these little departments, I think, are catalysts. So they are changing it. And as employers ask for this, it's something that people will start to become more interested in. So I did introduce myself a little bit at the beginning at a very high level about what I do. So I'll talk about a bit more in depth about what I do. So I do physiological measurement. So we do overnight sleep oximetry. You can see here, I'm not sure if you can see my mouse, but on the left you can see a device that goes on your wrist and on your finger. Some people might know what this is already. It's a pulse oximeter. So we use this and put on the patient overnight. They wear it while they're asleep, and we can help diagnose sleep disorder breathing. So we built a lot of the software around this ourselves. For example, the patient record system we built around it, and the reporting structure we built around it. Then we learned to understand the results, and then we send the results to the consultants to review. And if they're abnormal, we mark them as urgent. And then with that data that we produce, now we've got huge amounts of data on sleep. We're able to do research into that. So this is where we can apply the computer science part of it. We're able to do AI, machine learning, and maybe even predict certain types of people might get sleep apnea based on this, by these variables. Another thing is spinal cord monitoring. So this is quite a surreal one, coming from a computing background. So I'm in my workplace at the moment now. I'm learning all the physiology I need to perform this stuff. So it's a very specialist area that I'm learning. Learning is a big part of things. We were able to learn and do career CPD courses on physiology just to top up our skills. But spinal cord monitoring is a really surreal one, because this is where I'm in theatre monitoring someone's spinal cord. I always find that so strange, while they're having corrective surgery, to be there inserting the needles into somebody to send the signals down to measure the to make sure that they don't lose signals in the leg, so there's no spinal injuries while the surgeons are correcting the spine. So that's a clinical task that we do and take on board. But we also have that data that we can then later analyze again for research. So I think that's a pretty cool area. I'm also involved in brain pressure monitoring. So this device on the right-hand side is a medical device built in our hospital. So it's called intracranial pressure monitoring. So it was built by somebody who worked in my department previously. It uses Arduinos for the handsets and the interfaces. It uses Python for the software then to produce the reports. And the report you can see at the bottom there with the wriggly lines is what that device reports. And because the medical device regulations say that we're able to use a medical device that we've built in-house in the same entity, we're able to do that. And as clinical scientists, we can use it. So we go up to theatres and onto the ward to connect it up. And also, we're involved in the research of that. So this device has an accelerometer on it that measures patient movement. I'm doing a bit of research around how ICP artifact and movement artifact correlate. So this is a really useful area where the computer science skills are really useful for signals analysis, data analysis. So outside of that clinical stuff that we do, I do development as well, so software development. So this is from my master's project, actually. This is a fault logging system for one of our linear accelerators. So these are the big devices that treat cancer patients. They tend to break, but there's no way of managing them at the moment other than spreadsheets and an old clunky system. So I designed and developed a prototype for a tablet device that can raise the alerts and track the alerts. These things they're not brand new to software engineering, that these products exist, but it's just in the area that don't exist because it's so specialist that these pieces of software, there's people don't really shout about it, so they don't really know it exists. But this is where computer scientists as clinical scientists can make a huge difference. So in user evaluation, so the image on the left here is a sort of a workflow of interaction. For those who may have studied human-computer interaction, you might recognize this. If not, it doesn't matter. Basically, we have access to other healthcare professionals. So I could sit alongside a radiographer and learn how they work to build this solution for them and then evaluate it with it. It's quite difficult to do that outside the NHS because the staff are busy. Getting evaluations in the NHS tends to be so difficult, getting it through trust IT departments and stuff like that. So this is where I think computer scientists and clinical scientists can really make a huge difference with software development. Another example, this is an innovation project that we've been working on. We 3D print bones now. So we've taken CT, so broken bones and CT scans and converted them into 3D models and print them on 3D prints. The idea of 3D printing is, as I say, is not new. Taking it from a CT scanner isn't that new, but not many places are doing it because not many people have the skills to do that in-house. Doing it externally opens also, you know, there's lots of problems doing it externally. You've got information governance considerations. It's sending the scans to third parties to deal with. But again, this is an example where computer scientists, software engineers, becoming clinical scientists can make a difference here because we work in the NHS, we understand the technology, we understand how to do this stuff, we can bring it to life. And this is what we've done in this scenario. And then IT stuff that we do. Back in my previous role as a clinical technologist, I did do a lot of this, but I don't do much IT support anymore. I do more of the computing and the stuff behind that now. But again, I'm still slightly involved in this, but this is a backup solution. So we manage the backup solution for radiotherapy. The hospital IT department don't do this. And this goes back to the idea that radiotherapy is really regulated, which I'll talk about again, but there are laws in place, which means that only certain people can do this stuff. You have to, and this is why hospital IT departments can't do it because they just support so many different systems that they can't go through all of the specific training for radiotherapy. So this moves on nicely to areas that are regulated. So one of the strong motivations for somebody working in the area to become a registered clinical scientist is because some of the areas are hugely regulated. Radiotherapy being a really good example, and rightly so. I mean, it uses radiation to treat cancer patients. The same thing for X-rays. You know, you go for X-ray, but this is a really high-powered X-ray that destroys tumor cells. It's regulated by the ionizing radiation and medical exposure regulations, which states that medical physics experts must be involved in all decisions, equipment, and commissioning of equipment that involve radiation. This includes software. So if you can imagine, you know, not to sort of say that if this is bad or bad practice, because you know there are bright, you know, software engineering is an area that anybody can really learn. But the good example is, you know, a physicist might go away and build a piece of software, commission it, release it, and then find out later it's susceptible to an SQL injection, and then it gets attacked. Bit far, you know, a bit extreme, but it's possible. At the moment, there's little authority or framework for anybody working in computing to challenge an MPE. It depends on how receptive your MPE is. Usually, a lot of people are quite good, they'll work together, but some centres are so small, they don't have any computer scientists to challenge the MPE or to say this is bad practice. But there is an ability for you to become that clinical scientist and learn the physics and eventually become an MPE yourself and be really involved in that. And also software as a medical device is becoming heavily regulated. And just going back to the brain pressure monitoring example that I used previously, there are provisions that allow hospitals to build and use their own medical devices in the same hospital. So we don't see at the moment, so there are software development departments in IT departments in the hospital, but a lot of the output at the moment seems to be around corporate and decision systems and intelligence systems, and patient record systems. They tend to leave the medical devices to manufacturers, but what we're finding now is there are small pockets, for example, in medical physics, and some junior doctors who've learned Python at school now, who are coming through and developing software which is very much a medical device now, whether it's class 1 or class 2, but I won't get into the different classes. And this is another area where computer scientists registered as clinical scientists can really get involved in good design, good software engineering, and become that sort of partner now with these other registered healthcare professionals developing software. And because you are registered, you've got that trust behind you and the competence behind you that demonstrates to somebody else that, hey, I'm registered too, but I'm an expert in this area. And I'm finding for myself, this really does work. They are respecting the opinions, especially going back to the 3D lab. That's sort of carrying that weight now. And it's been happening now. Physicists and engineers are building these medical devices and software, so why not computer scientists? But I just want to say though, a lot of this is for debate. It's my opinion, open for healthy debate. It may be that we're just seeing a shift of people gaining these skills and being equipped with them in the workplace now, so that we might not need people like us anymore. Or alternatively, I think there is a greater need for us to enter this field, because we are studying and developing those skills, and we can use them for direct patient care. Really good example, wearable technology. So being able to build the ECG machines, understand the ECG machines, and provide the results to the doctors is a fascinating position to be in. So in a nutshell, I might move this away. I think my mouse has gone to sleep actually. Wake up mouse, there we go. I don't know whether this is in your way actually. It might be grayed out. So in a nutshell, this is why I see clinical computer scientists as a profession going towards or doing. So we understand, you can sort of see to the left of the screen there, we've got the understanding of the infrastructure, the IT areas, because of the university training or the industry training that we've had. But then we learn to understand the clinical needs, the scientific knowledge, the medical devices, the service improvement, clinical service improvement, and the compliance. And I think this area of healthcare makes very powerful clinical computing projects. So that's me. Hopefully that was interesting and useful.